before 7 days of surgery. So last donation, it must be 7 days before surgery.
There also the hemoglobin has to be 12 grams.
No, it's not like the normal donation. Here you can take blood in cases where hemoglobin is more than 11 grams. Even with 10 grams also you can take.
The recipient's blood should be 11 grams.
Sorry?
Donor and recipient
Same.
Donor and recipient same. The whatever is donor selection criteria is strictly for whatever we are doing day to day, whatever is said is strictly followed in blood bank. But for this auto donation, you don't require, like some cases with some medicines, with some minor ailments, you can take blood. Unless you have the big organic diseases, you can take blood for all cases. They are suitable for autologous donation.
These cases autologous blood transfusion is collect as autologous.
Yes.
What do other tests so that it can be utilized for other cases?
That is not, that's I said. Unless blood has to be discarded because the donor selection criteria are not strict.
You take the criteria of the routine blood transfusion, routine blood donation, so that it can be used.
Then the person will be a surgical blood donor.
Basically, what it is?
Not autologous.
It is a very good novel concept, but it is not up to the very high moment because of the same problem.
It has to be, that's why I said initially, this is a teamwork. That's why initially first I said this is a teamwork and then the hospital must have policies. Without this, you cannot implement this. Because everybody is involved in this.
Sir, basically, what is the tactic of why it will not pick up the moment? I was discussing this thing. That means that most of the blood donation is done on the emergency basis. Whether this autologous blood donation is effective, but where it is a boon, particularly for us like coronary artery bypass surgery, like your hip replacement, plant. In this case, where 5 units of blood is must for everyone to undergo for bypass. This type of cases, but now again the problem is what? Suppose the 1 month before, I am choosing one patient for CABG, and 1 month before I will take his 5 units of blood. What will be
5 units will not take.
4, 5 minimum.
No.
Maximum. Yes, up to
Yes,
5.
you can take.
Up to 5.
At least in the 3 days you can take blood.
Requirement.
5 unit bypass. So again, what happens? We are suspecting whether it will be the adverse effect of the patient.
Contraindication.
Coronary disease, heart disease are contraindication.
Hip surgery?
Basically, any stable patients are suitable.
Hip surgery, bypass, hip, whether it is a planned is needed.
Bypass you cannot.
Only
bypass you cannot take.
Orthopedics.
And plant surgery. Bypass you can take that salvage one. That salvage and where from the operation wound it will be taken.
Chances that whether
Yes.
people angina after taking the blood that part.
Salvage one. You can take the blood loss operation. Oita you are collect kore de debe.
That's what I couldn't understand.
Initially, it was said there is no requirement of blood proofing, testing on compatibility because the blood is collected and reinfused basically. But now, to avoid the clerical errors, if something wrong is there, so it accidentally some is said like sometimes the blood is carried to other hospital. Patient is not. This is here. Then it is accidentally transfused to other patient. Just to avoid the complications, this becomes must.
Well, not on scientific ground, but
No,
this
just to minimize the clerical error. This is must. That's why I said if it is a closed pack policies are there, then it's not required. It is strictly followed. The autonomous donation units is followed. All the policies were following it. Then it's not required. It's not must. Just to be on the safer side, if accidentally transfers to other patient, then even those patients who are positive for TTD marker, like hepatitis A, even you can collect blood from them and you can transfuse the blood to them.
So if the patient is suffering from hepatitis B or hepatitis
Yes.
autologous,
Yes.
so we can give same
Yes,
patient.
same patient. You can transfuse them. There is no harm.
Madam, what is massive blood transfusion?
What is?
Massive blood transfusion.
Massive blood transfusion when you are replacing blood volumes. I think 20% of the blood volumes are exact percentage I cannot remember. It's 20% or some blood volume within 24 hours. Like roughly I can say if you transfuse the blood patient with 10 to 12 unit of blood in 24 hours, there is called massive transfusion.
And what are the hazards of massive transfusion?
Massive transfusions like our fluid one of all these complications will there, and hematologically you will have thrombocytopenia, that is very important. You will be very afraid of patients having the very low high platelet count, but it's because of the massive transfusion. Then other complications of hemodialysis are like all these low hemoglobin and all these things. Now we were talking about transfusion. Then the main complication is because of hemodialysis and thrombocytopenia. That is the main complication.
Another important is the chance of bleeding. Chance of bleeding.
Yes. Anticoagulants are
That's
also.
why the chance of bleeding are there.
Because of the hemodialysis.
And number two, there will be
Other
some
complications of hemodialysis.
this electrolytic will be there.
What are the procedures for autoimmune hemolytic anemia, blood transfusion?
Autoimmune hemolytic anemia.